Vanakkam. Congenital anomalies of the hands or congenital differences as they are known now are quite common. They are sometimes totally functional, though they may not look so. As Adrian Flatt said, they can be a functional triumph but a social disaster. Recognition and treatment of these congenital differences is based upon a solid understanding of how the hand is developed in the embryo. It is actually a beautifully choreographed dance of events that occurs when the hand and the upper limb develop, and I have tried to make it as simple as possible in this video. Generally, congenital anomalies affect 1 to 2% of newborns, and approximately 10% of these children have upper extremity abnormalities. So much so that congenital limb anomalies are second only to congenital heart disease in the incidence of birth malformations. The nomenclature nowadays is to avoid the use of the term anomalies. Instead, use the term differences. So, congenital limb differences. Before learning about the different congenital limb differences and their management, it is important to learn how the hand develops in the embryo and the fetus. We will learn about this embryology first by learning about the sequence of events, the signaling centers for growth and the factors that play a role, and finally the embryogenesis of different parts of the upper limb. The first two we shall see in this video, that is the sequence of events and the signaling centers for growth and factors playing a role. Before learning about the sequence of events in the development of the hand in the embryo and the fetus, we need to have a particular timeline. This timeline could be based on the phases of development, the Carnegie stages, the number of days since fertilization, or the size of the embryo or fetus in which the particular event is occurring. When we consider the phases of development, we will note that there are three separate phases: the pre-differentiation period between weeks 1 and 2, the embryonic period between weeks 3 and 8, and the fetal period beyond 8 weeks. As far as the upper limb development is concerned, it is mainly in the embryonic period and the fetal periods. In the embryonic period, that is between weeks 3 and 8, the differentiation of upper limb morphology begins with the arm bud or the limb bud, which develops around the 5th week. In the fetal period, between 8 and 14 weeks, there are three phases of development of the upper limb. In phase 1, the shape of the upper limb and the hand develop, especially between 8 and 10 weeks. What is notable in this phase is the development of the asymmetry of the hand primordium, the development of the slot for the thumb, the development of fingers in the same spatial plane, and the entire external shape of the hand is accomplished usually within this period, and the digital interdigital pads also become prominent. The second phase of the upper limb development during the fetal period consists of the phase when the creases develop, usually from 10 to 13 weeks. The interdigital pads begin to regress around 11 weeks, the digital pads regress around week 13, the thumb crease forms around 10 weeks, and by 12 weeks, the proximal palmar and distal palmar creases have formed. In phase 3, the ridges form, usually beyond 13 weeks of development. The formation of the ridges begins off the lateral part of the fingertips, which proceeds from a lateral to distal to medial and then the proximal position at the end of the phalanx. This almost completes the upper limb development. The sequence of events of development of the upper limb in the embryo can also be discussed in relation to the Carnegie stages. This is a standardized system of 23 stages which is used to provide a unified developmental timeline of the embryo. The stages are delineated through the development of structures and not by the size or the number of days since fertilization. We shall be using the Carnegie stages to describe certain developments in the upper limb at different points on this video. The sequence of events can also be described in relation to the number of days since fertilization or the size of the embryo in which the particular change occurs. For instance, at 26 days after fertilization, the size of the embryo is around 4 millimeters and the limb bud develops around this period. And at 47 days, the size of the embryo is around 20 millimeters. There is an appreciable growth in the size of the limb bud. Around 52 to 53 days, the size of the embryo is around 22 to 24 millimeters, and by this stage, the fingers start separating. By 8 weeks, all limb structures are complete. So far, we have mentioned the limb bud or the arm bud development, and that seems to be the beginning of the formation of the upper limb in the embryo. We shall now try to understand how this structure forms and from where it forms. On the dorsal aspect of the embryo, in the midline, we have the neural tube and the notochord. On either side of this, we have what is known as the paraxial mesoderm. Immediately lateral to that is the small intermediate mesoderm, and the lateralmost is known as the lateral plate mesoderm. The intermediate mesoderm gives rise to the kidneys and gonads and does not play much of a role in the development of the upper limb. The paraxial mesoderm contributes to the formation of the axial skeleton, the muscles of the limbs, the nerves of the limbs, the vascular elements, and the skin of the limbs. And the lateral plate mesoderm contributes to the bone, cartilage, and tendinous structures of the limbs. When the limb bud develops on the lateral aspect of the embryo, both the paraxial mesoderm and the lateral plate mesoderm elements move into this limb bud to contribute to the formation of the different structures of the upper limb. This limb bud or arm bud, as it develops in 3 different dimensions or axes. The proximal to distal limb development, which ensures the different structures along the length of the upper limb. The anterior posterior limb development, in which we are referring to the differential development of structures on the dorsal aspect and on the volar aspect of the upper limb. And the third axis is the radio-ulnar limb development, where the structures on the radial side need to develop differently from the ulnar side. First, let us consider the proximal distal limb development. This axis of development ensures that the shoulder, elbow, and wrist, and finally the hand formation occurs correctly. This axis of development is again controlled by the apical ectodermal ridge (AER), which is a thickened layer of ectoderm that condenses over the limb bud. This apical ectodermal ridge guides the underlying mesoderm to differentiate into the appropriate structures. In the Carnegie stage 13 embryo, the limb bud develops. This diagram shows the position of the apical ectodermal ridge. Let us try to understand this better. These are the proximal and distal portions of the limb bud. The apical ectodermal ridge or the AER is situated over the growing end of this limb bud. It regulates limb development so that the humerus, the forearm bones, and the hand develop successfully. If this apical ectodermal ridge is removed, as in experimental studies, limb truncation occurs. When it is removed early, only the humerus is seen to develop. When removed late, the humerus and forearm bones develop, but the hand does not develop. To prove the importance of the apical ectodermal ridge in the proximo-distal development of the limb, ectopic implantation of the AER led to the formation of an additional limb in experimental studies. This AER is able to exert its influence by the means of fibroblast growth factors, especially fibroblast growth factor 10 and fibroblast growth factor 8. This has been proved in experimental studies because when the AER was removed and replaced with fibroblast growth factor beads, the limb growth was seen to be normal. When talking to parents of children whose upper limbs have been affected by a transverse arrest, we need to talk about certain points. We need to mention the factors that can affect this apical ectodermal ridge that contributes to the proximodistal growth of the upper limb. Usually, bleeding or ischemia within the apical ectodermal ridge can cause the damage. Transverse deficiencies that occur, that is, arrest of growth of part of the limb that may occur, are usually sporadic. This means that they can occur without any underlying reason like a genetic problem. These transverse differences are not inheritable and future children are unlikely to be affected. Next, we shall consider the radial ulnar limb development. This usually develops in an anterior-posterior, also called preaxial-postaxial direction. Now let us try to understand this better because a particular rotation is going to occur in the limb of the embryo. To understand the orientation of the limb bud in the embryo, you will note the preaxial border, the postaxial border, the ventral side and the dorsal side. This limb bud undergoes a lateral rotation which differs from the lower limb which undergoes medial rotation. So in the upper limb bud, the preaxial border becomes the radial border, the post-axial border becomes the ulnar border. The development of structures in the radial border and the development of structures in the ulnar border must be different. This radio-ulnar limb development is controlled by what is known as the ZPA or the zone of polarizing activity, which is present in the posterior margin of the developing limb bud. In the limb bud, we can note the apical ectodermal ridge and the purple colored patch which represents the zone of polarizing activity. And this is present on the posterior aspect of the limb bud close to the post-axial border. We have already seen that rotation of the limb bud is going to occur. So when the rotation occurs, this zone of polarizing activity is almost close to the ulnar border of the developing limb bud. This zone of polarizing activity activates what is known as a signaling pathway which polarizes the limb into a radial margin and an ulnar border. And the signaling molecule in this pathway is known as the sonic hedgehog compound. Transplantation of the zone of polarizing activity or the sonic hedgehog protein or the SHH causes a mirror duplication of the ulnar aspect of the limb. The extent of this duplication is dose dependent with greater transference resulting in more replication. And this is the reason for development of multiple numbers of fingers, sometimes known as polydactyly. Another important axis of development is the dorsal ventral limb development, where the structures on the dorsal aspect need to develop differently from the structures on the volar aspect. In other words, the process of differentiation between the dorsum of the finger with the fingernail and the volar surface with abundant pulp tissue on the hand is one of the features of this dorsal ventral limb development. This development is controlled by what is known as the WNT signaling pathway, which is present in the dorsal ectoderm. This signaling pathway uses a transcription factor called the LMX1 that induces the mesoderm to adopt dorsal characteristics, that is the extensor aspect of the upper limb. In the ventral ectoderm, this pathway, that is the WNT pathway, is blocked by a product of the gene engrailed 1 or the EN1. The congenital differences affecting this pathway are relatively rare. The loss of LMX1 is associated with what is known as the nail patella syndrome or the Fong disease, which is characterized by fingernail dysplasia, hypoplasia or absence of the patella, presence of iliac horns and elbow deformities. We have seen how the limb bud develops in three different axes. Obviously, a lot of factors have to play a role to make sure that the development occurs correctly. The markers that help in development are cellular markers, biochemical markers, and molecular markers. The other important factor that affects this growth of the limb bud is the genetic pattern. The cellular markers that play a role in the development of the limb bud in the embryo are present throughout the upper limb, but more prominent in the hand. The formation of digits in the hand occurs mainly at a cellular level. The spaces between each digit forms in a distal to proximal direction by two distinct processes, apoptosis and lysosomal enzyme mediated cell death. In the early phases of cell death, the apoptosis is more prominent and present at higher levels than the enzyme mediated lysosomal degradation. The process of apoptosis is by a death stimulus which causes the cytochrome C activation, leading to fragmentation of cells and ultimately cell death. In the late phases of cell death, apoptosis is at low levels and enzyme mediated lysosomal degradation is of high levels and more prominent. The cell death here is mediated by reactive oxygen species and cathepsins. We have already mentioned certain biochemical markers in our description so far. Let us try to consolidate the role of these biochemical markers in the development of the upper limb in the embryo. Different biochemical markers are seen in the different axes of development. The anteroposterior axis is mediated by the zone of polarizing activity which secretes what is known as the sonic hedgehog protein, the SHH. This marker helps in establishing the radial and ulnar sides of the limb and is usually the first axis to develop. The dorsoventral axis produces a protein called wingless type mouse mammary tumor virus 7A, WNT7A, which we have already mentioned earlier. We have already seen how on the dorsal side, that is on the extensor side, this induces the transcription LIM homeobox transcription factor LMX1, which leads to dorsalization of the limb bud, and on the ventral side there is a negative feedback loop brought about by the transcription factor engrailed 1 EN1, which inhibits the WNT7A expression. These biomechanical processes ensure that the palmar and the dorsal aspects of the hand are formed normally. The proximodistal axis, mediated by the apical ectodermal ridge, secretes several fibroblast growth factors, fibroblast growth factor 10 and fibroblast growth factor 8 among many, that differentiate the limb bud. These factors ensure that elongation of the limb occurs. Apart from cellular markers and biochemical markers, there are certain molecular markers that play a role in the development of the upper limb in the embryo. These are usually protein factors such as ligands, receptors and transcription factors which play a critical role. They induce differentiation and proliferation of neighboring cell populations, stimulate signal transduction to cause structural and functional changes in cell behavior, and also cause transcription factors to travel into the nucleus of the cell and create new DNA. Finally, the genetic markers. Genetic markers play a role in the normal development of the upper limb. Mutations of some of these genetic markers may result in certain congenital differences. For instance, mutations within the HOX gene locus have been identified as the cause of synpolydactyly, hand-foot genital syndrome, and T-box gene abnormalities have been linked to Holt-Oram syndrome and the ulnar mammary syndrome. Parents of children with congenital differences of the upper limb and parents who have congenital differences need appropriate counseling regarding the different expressions and phenotypes expressed across the spectrum of a particular mutation. For instance, the parent may have a mild phenotype and no gross difference seen. We need to counsel them that there is a big spectrum of this expression of the phenotype and the child may be affected with a severe phenotypic expression of the same genetic mutation. So the parents should be prepared for this. We have seen quite a lot of information about how the sequence of events of development of the upper limb in the embryo occur. Let us see a summary of the actual events that occur. In the Carnegie stage 13, about 28 days of development of the embryo, the early limb buds appear and start developing. At around 32 days, that is Carnegie stage 14, the dorsal and ventral limb bud flattening and the thickened apical ectodermal ridge at the distal tip can be seen. At day 41, corresponding to Carnegie stage 17, the scalloped edge conforms to the condensing digital mesenchyme in the hand. By about 46 days of development, the Carnegie stage 19, separate fingers can be seen and ossification has begun in the humerus and shoulder girdle. By 49 days or Carnegie stage 20, ossification centers in the upper limb, lower limb and face have occurred. We need to note here that upper limb development is more advanced in time than lower limb development. By the 8th week, Carnegie stage 22, the fingers completely separate and ossification centers are seen in the forearm, that is the radius and the ulna formation. By week 9 or the Carnegie stage 23, metacarpal and distal phalangeal ossification has begun. By the 11th week, ossification in the proximal and middle phalanges is now evident in addition to distal phalanges and metacarpals. And by the 12th week, the nail fields have started developing. The nails become actually visible during week 16. So far, in trying to understand the basics of embryology of the upper limb, we have seen the sequence of events that occurs, the signaling centers for growth and the factors playing a role. But what about the embryogenesis of different parts of the upper limb? For instance, how does the vasculature, the skeleton, the joints, the muscles, the nerves and ultimately the hand, how do they develop? All these we shall see in the next video. I hope you liked the video. I enjoyed making it. Please do click on the shown links to see more about congenital differences, especially the surgery of congenital syndactyly. And do not forget to subscribe to stay connected with the latest in learning, hand surgery, plastic surgery, trauma surgery and ethics. Vanakkam.